honestly cannot believe what's happened to this bill in the last week. And, it's one of those situations where I can't say that I didn't do everything in my power to make it work, and how can anyone ask any more of me than that? And I know that many of you are frankly just committed to misunderstanding the bill. You're committed to misunderstanding it. I rose above the nonsense of last year. This year, I played it straight. I have been a model colleague to all of you. This bill went through 3 rounds of debate. It came out of the committee with full support. We modified the bill with an amendment to fix problems concerns that people had about the bill. We played it straight. We did it right. It's a good bill, and you understand the policy more than Governor Pillen does. In this legislature, we stand together as a family. We make the choice to trust each other, to trust the committee process, to trust the experts that come out and tell us that this is policy that not only Nebraskans want, that our localities want, but that's going to save lives. And in this legislature, I don't know if some of you understand that we take that seriously, and that doesn't mean that we allow the executive branch to tell us how we're going to act at the end of the day. If you're afraid of your bill getting vetoed too, guess what? We override that too. It's not a big deal at the end of the day. And I know better right now than to think that a lot of you have questions that I can answer about the bill, yet I stand ready to answer them. And I will also certainly go over what this bill actually does. But I also want to talk about the broader implications of this vote for this legislature. This bill is the first veto of the year, but yours could be next. We are an independent, co-equal branch, and you work for your constituents who trust you. And I've shown you that you can trust me. And if you don't want to trust me, you can trust people like the Chancellor of UNMC, the Director of the Addiction Psychiatry and Public Health at UNMC, Dr. Jerome Adams, who served under Governor Mike Pence during Indiana's HIV outbreak and then became Surgeon General under President Trump. You can trust Dr. Ali Khan, MD, MPH, MBA, former Assistant Surgeon General, the 3rd Dean of the University of Nebraska Medical Center College of Public Health, the former director of the Office of Public Health Preparedness and Response at the Center for Disease Control and Prevention, the CDC, which says this is a good bill. Many of your county public health directors, the pharmacists, the Nebraska Medical Association, the behavioral health providers, and Nebraskans with lived experience in recovering from substance abuse. This veto is not about me. It's not about your feelings about me. It's about Governor Pillen's feelings about me. And we know that because Governor Pillen said to many of you, who then came and told me, that this is personal for him. How come this came out of committee? How come it went through 3 rounds of debate? How come before we got to final reading, I had 38 yes votes on my card? But at no point in that time did the governor come up to me and say, this is going to face a veto, let alone say it's going to face a veto, and here's an amendment I would like to see you consider. Here's an idea to make it better. No, he didn't say anything to me like that. He just trashed it. And many of you went, oh, he must have a good reason. He told many of you the reason. He said, and I quote from one of you, I don't know why any of you are working with Hunt this year. We can't let her have anything. So if you think you've received some evidence that 44 other states, the Surgeon General under President Trump, this, that, and the other, that you know better than those people, by all means vote no on this override. But just be clear that that's what you're doing. It's not because you know better. People can just be committed to misunderstanding, and that's a really big barrier to overcome. So, Governor Pillen, in his veto letter, in his things that he's published online, this and that, he has cited a lot of misinformation in his reasoning for vetoing the bill. He cited 2 articles written by the same author, an economist, Annalisa Packham, and the paper is rife with methodological flaws, design limitations, ecological fallacies. It has artificial correlations. One of the papers is a working paper that was not approved for publication, and the other one is a newer version of the same paper, which is being examined and critiqued by other academics due to questions they have about the validity of the study. Another concern that I hear from many people is, oh, this is going to turn us, I'm hearing this a lot from up here, this is going to turn us into San Francisco. Okay, San Francisco, population 8 million. Y'all wish it was San Francisco. Think about the tax revenue you could get with your Epic tax if we had 8 million people here. Please be serious. Denver, 3 million. Portland, 6 million. Passing this bill to allow local jurisdictions with the support of their city council or village board, which do you think that's going to be easy? You think they won't have opposition to that to overcome? Can pass a syringe service program under LB 307 that will be managed by a behavioral or public health clinic. Do you think behavioral and public health clinics that are run by your localities, who you trust when you're dealing with a healthcare-related bill, who talk to you out in the lobby and then you come in and vote their way because you're convinced by the evidence, do you think that those same people are handing out needles to kids, as Governor Pillen has fear-mongered and said is the case? Be serious. Be serious about the work in here. That's all the bill does. It doesn't say someone can open up a tent at 72nd and Dodge and hand out free needles. City council has to approve it. That's not easy. Has to be run by public health org. And nothing in the bill forces your community to have this. But if you vote to keep this veto, if you don't vote to override, you're taking the opportunity away from localities that do want this. Most of your public health districts have seen a rise in fentanyl use and opioid abuse, opioid use. And Nebraska is one of the only states that has seen a rise in HIV and hepatitis C when the rest of the country is going down. So what are we going to do about that? Some of you have said, well, I agree that we need to do something about addiction. We need to do something to get people into treatment. Mr. President, how much time do I have? Matt, how much time do I have, Mr. President? Okay, forget it.
1 minute.
Thank you. Wow. A lot of you have said, we want to do something to get people into treatment, but this isn't it. Okay, so what is it? Governor Pillen has released his budget recommendations, and the budget recommendation includes a $15 million cut to behavioral health aid, totaling $30 million across the biennium. That's an 18% cut in each year from what was approved in last year's budget. So what is that money going to go for? That's money that would go to substance abuse and addiction treatment. But we have a bill before us today, LB 307, that costs nothing to taxpayers. It is free. So if you're serious about facing this problem, trust me. Your constituents trust you. Trust the process that we went through here in this legislature. Trust the more seasoned senators in this body who know from their experience that this is a good bill. And trust the experts who know that this works to treat addiction. That is the whole point. Thank you, Mr. President.